Hi there, my name is Bobby Greenhalgh, and I will be presenting my poster. I'll go ahead and share my screen and jump into my poster presentation. Okay, so thank you for watching my poster presentation. My poster is titled AB, Changing Criteria on Design for a Swallowing Intervention on an Adolescent with ASD, Autism Spectrum Disorder, and ID, Intellectual Disability Diagnosis. So my poster is focusing on the target behavior of swallowing, specifically swallowing medication. When someone can't swallow medication pills, it can lead to missed doses, reliance on alternative forms of medication, and even negative side effects from those alternatives. So this is a skill that directly impacts health, independence, and quality of life. My research question guiding this study was, can a shaping procedure help someone learn to swallow gradually increasing sizes of pill-shaped items? The participant in the study is a 14-year-old male with autism spectrum disorder and intellectual disability. He's also pre-diabetic and has been prescribed metformin. The challenge is that the extended release version can't be crushed, and the crushable version quick release causes him gastrointestinal discomfort that can lead to changes in emotional affect and in some extreme cases resulted in absences from school. Before beginning this study and this intervention, a medical assessment was conducted, as well as an assessment by a speech and language pathologist, looking specifically at the motor ability to swallow. The assessments concluded that John, the participant in this study, John Doe, using a pseudonym, has the basic motor skills needed for eating and swallowing, but that the participant isn't able to swallow pills. Ruling out medical reasons for the behavior of swallowing pill-shaped objects, we selected this target due to a lack of the skill being admitted and it acting as a barrier to some forms of effective medical treatment, thus making the skill highly relevant and socially significant to target. If we go down and we look at the literature here, we see that this is an uncommon issue. Research shows that individuals with ASD or intellectual disabilities often need systematic instruction to acquire pill swallowing skills. More specifically, shaping procedures where we reinforce small steps towards a final goal have been shown to be effective in teaching complex behaviors such as this. Several studies have successfully used gradual increases in pill size or pill size shaped objects to build this skill. Moreover, I went through a number of Piazza authored studies as the author, have an extensive research background in swallowing and feeding behaviors. Moving on to the methodology, for this study I used a changing criterion design, which is useful when you're gradually increasing expectations over time or implementing shaping procedures. The independent variable was the shaping procedure, as well as embedding the items targeted for swallowing into a preferred food item using a long, narrow plastic spoon, increasing the size of the edible item step by step. The dependent variable was whether the participant could swallow the item without chewing. And then objective criterion of this target behavior is specified in the following section that I'm highlighting right here. So data was collected on each attempt, scoring it as correct or incorrect. And then that raw data was converted into a percentage correct score for each session for display on the graph above the methodology section right here. Baseline involved no intervention, with the parents providing a sprinkle with a glass of water and asking the participant to swallow the item. During the intervention, subphase 1, I introduced the shaping process as well as the shaping strategy, which I discussed before. This was To recap, embedding the item in food alongside using a long plastic narrow spoon to allow for a deeper insertion of the food item and the item targeted for swallowing, while simultaneously allowing the participant to close their mouth around the spoon and swallow while the spoon remained on their tongue. So this approach via spoon use mirrored a study by Milnes and Piazza et al. 2019. In summary, the items selected gradually increased in size across subphases. Each time the item was embedded in yogurt by myself, the participant then took the spoon and self-fed, and reinforcement was provided for successful attempts as well as participation. Differential reinforcement was used, in which the participant's participation led to 5 minutes of preferred video game time before school, and successful swallowing across all 3 opportunities for that session led to 10 minutes of preferred video game time before school. The movement to the next level or the next subphase only occurred after the participant showed consistent success of 100% of opportunities, with 3 opportunities per session across 3 consecutive sessions. I should mention too, as we can see from the data, there was a subphase in which success did suddenly drop, and I will get into that now as we go over the results. So in baseline, we can see that performance was inconsistent and never reached mastery. As soon as intervention started in subphase 1, we can see there was a clear jump in performance to 100% success across 3 consecutive sessions, showing a strong effect of the independent variable on the dependent variable. However, in subphase 2, performance dropped and became a variable. At this time, I was suspicious that the change in the dimensions of the stimulus targeted to be swallowed was too large of a departure from the previous subphase. So I discontinued this subphase and selected an item that was still larger than the previously successful subphase, but had more in common with the shape of the previously successful subphase. What is interesting that once this change was made in subphase 3, performance immediately improved again and stayed high through subphase 4. I believe this to have confirmed my suspicion that the items used for those subphases have more in common in regards to the mentions of subphase 1, and that this quality seems to be conducive to success for this participant. Moving on to the discussion part, overall, the results support the use of shaping to teach pill swallowing. The difficulty in subphase 2 likely wasn't just about size. It may have been due to the change in shape of the stimulus as discussed. When the shape returned to something more similar to earlier items, performance did improve again. This suggests that when teaching this skill, it's important to consider not just size, but also the form of the item. Keeping those consistent while gradually increasing difficulty may lead to better outcomes and could be an important factor to consider when developing future research studies. That concludes my overall poster presentation. And if you have any questions or comments, please feel free to reach out, and I'll be more than happy to respond. Thank you. Have a good day.